Good evening, YouTube family. It is me again. I'm back. This video is another clinical series, and basically what this one is about is just about the progression of clinical. So where you start at and where you hope to end at. It is pretty, it seems like it's a lot, but it's really not. So I'm just going to go over some of the basic things that you do, and then how, as you're going along, how those things kind of progress to where you are or where you want to be by the end of your first semester clinical. Okay? So when you first get there, I did a video about the first day of clinicals. Your first pretty much week. I mean, I'm not sure how everybody else's is, but with my school, we have 2 8-hour days of clinicals. So your first week, which consists all of 2 days, you are basically in there getting comfortable with doing your vitals, getting comfortable with the floor that you're on, and really just getting comfortable with interacting with your patient. That is basically what the first week, possibly even 2, consists of. It's not a whole lot, and then you're also getting used to charting. I'm not sure if your schools allow you to chart, but we also are getting used to our charting systems, which can be a headache, but eventually you get there. And that is the beginning. That is basically where you're starting at. You are green as ever, going in not knowing what you are really doing and just kind of feeling your way through it. So that is basically what ends up happening in the very, very beginning stages. As you start to progress, you start to kind of get confident. You should be confident with getting vitals, by the end of the first semester. Practice, practice, practice. Practice at home. Harass your friends and family. Do it. Carry your cuff and stethoscope everywhere. Yes, it may be Joe. It's Joe. But do it. Because then when you're in a situation where you are asked to get vitals, you can be confident that you have gotten correct vitals. I mean, and there are lots of situations where you are going to have to use those manual cuffs. Believe it or not, there are a lot of situations. If you ever have a patient who's reading at a low or high blood pressure, it is often customary for you to get an actual manual pressure to confirm that. So it's not like, you get into these hospitals and things like that. The sphygmomanometer is not obsolete. You still have to use it. So get good at using it. As we progress through clinicals, we also did the head-to-toe assessment. Now, the head-to-toe assessment is a very detailed assessment. I admit when I first started doing them, I was not extremely confident doing it because I felt like I was really bothering my patient. I mean, you have to understand, I was on a telemetry floor. A lot of these people have come from like ERs, and they've already been through the head-to-toe assessment gamut. And it's, so coming in and as a nursing student, and I'm just used to getting the vitals and things like that, and then having to actually, do all kinds of stuff to them. It took me a couple days. It took me a couple days to get that together. But you will get comfortable doing it. Usually when you go in, you're doing it in the morning. We usually do it, you have to actually do it twice in the same day, yes. So imagine how uncomfortable I was doing it once, then having to do it twice to make sure nothing had changed 4 hours later. So I'm very grateful to our patients. They are very, very patient with us. And a lot of that has to do with you you have to get yourself together, I should say. You shouldn't go in feeling, even though you may feel like you're bothering them, you shouldn't go in with the attitude, oh, I'm bothering you. You know, get your ducks in a row, go in there, do what you have to do. Head to toe assessment should not take very long. In the beginning, it may take you maybe 10 to 15 minutes. By the end of the semester, you should be able to do that in about 5 minutes flat. You know, you get really used to the routine, and you get better with it. When you have heavy patients, not heavy as in like fat or thick, heavy as in like lots going on with them, you can kind of lose your time management skills. I have been guilty of that. But you really have to get organized. They had us have 2 patients at one point, and you really get a good respect for nurses. Okay, the ones who are actually out there already doing it. You have a really healthy respect for what they're doing, because I swear I struggled all day with just 2. Okay, just 2, and one of my patients was off the floor for like half of it, and I still felt, you know, I had to like stop and like go into a little cubby hole and like just breathe for a second. Like, I cannot believe you guys are expected to have 4 and 5 and 6 how do you do it? How? But they just get really, it comes down to having really good time management skills. You know, you really have to do that and still be compassionate and still be there for your patients with an S, because there's multiple. It's not likely that you're going to go out and have just one patient unless you're on like a critical care or a 1-to-1 or something like that, where that patient is just that heavy that only one nurse can deal, and that's very rare. But anyway, as you start to progress, they're adding more responsibilities. Now you are learning to pass meds and things like that, which you're always doing with your instructor. Rule number 1, don't do nothing without your instructor. You know, all the basic stuff, okay. But anything that you are unsure about, grab your instructor, okay? Don't do anything strange. Don't touch no IVs. Don't do nothing without your instructor. You also get to talking with the doctors. When I first started, I did not have a whole bunch of confidence around all those white coats. Where I am at school at, it's a learning hospital, so when the docs hit the floor, like you thought the navy blue uniforms, but they hit the floor. The nurses do this hit the floor. The docs hit the floor, and it's like, wow, there are so many of them from so many different disciplines. It's crazy. There's just white coats all over the place. And I was kind of timid, you know, around them, and I didn't, you know, I would just stand there. I would listen to what they said, and it's always good to, like, when they're talking to your patient, to always get in there, be in there, see what's going on, because that gives you a better understanding of what's going on with your patient, and, you know, kind of get used to that doctor-patient interaction and stuff like that. But as you progress further on, you actually get comfortable talking with the doctors, because a lot of times they'll come in there and actually ask you questions about the patient. So be read up on your patient. Yes, they will ask you, the nursing student, name badge, say nursing student and all, okay? Blue uniform already lets you know I don't know jack. They will come in and ask you questions, and they expect you to know, you know, the answers. You know, they'll ask you questions about your patient, and I haven't been asked a question that I really didn't know the answer to. A lot of times you will know what's going on with your patient. You should never be halfway through the day and not know everything that's going on with your patient. That's just unacceptable. So make sure that when you're getting in there, you are talking to your patient, you get that report from the nurse, you are reading those charts to find out everything that's going on. When the docs ask you questions, you will not feel like an idiot. You also, about talking with, as far as talking with the docs, you also get to a point where you have to you get to that point where you are your patient's advocate. I had a situation where my patient was, he had come back from some type of surgery, and they had him on a liquid diet because he wasn't really tolerating solids that well, and as well as for the preparation, for the. I can't speak tonight, y'all. It's late. It's like almost midnight. I'm up for no reason, but anyway. So anyway, he was on a liquid diet and he was ready to move up. Now, everyone he's talking to is telling him, oh, okay, well, we have to talk to the doc. We have to talk to the docs. So when the docs actually hit the floor, they came into his room, and they were talking to him. He was agitated for some other reason, for whatever was going on with him. And he had forgot to mention that he wanted to go into a solid diet. So before they left the room, as they were about to leave the room, I brought that to their attention so that while they were there, because it's hard to track down the doctor sometimes. Seriously, that I don't. It make you want to grip them up sometimes. Y'all gonna get there. Anyway, but while they were there, so they could change it and it could be done, and we could discuss any concerns about upping his diet at that point in time while he was there. So you get used to doing things like that. You get used to paging the doctors, asking them for certain meds, and if certain things can be done, take your patient off telly, put them on telly, all kinds of, well, not put them on, you put them on, I feel like it, I think. But taking them off of telly and things like that, you, believe it or not, as a nursing student, first year, first semester, those are the kind of things that you will be getting into. Finally, you want to really get used to, by the end, you want to at least have a good concept of what it is to think critically in the healthcare setting. You're going to hear think critically, and they do not expect you by the end of the semester to be able to be a whiz kid at it. You won't be. It's absolutely awesome how they're able to do it, and you will get to that point where you're also able to do it. But by the end of the first semester, you're not going to be that awesome at it. But you will at least be able to start to put the pieces together. And that is where you should be. So by the end of the first semester, you should be confident in taking vitals. You should be confident in talking with your patients. You should have some level of comfort in talking with the doctors. You should be, I'm not saying they still can be intimidating. But really, they are no different than you. We're all getting basically the same training. They just go for a longer time. It doesn't matter. We all are on the same team, okay? Working together on the same team. You are just as accountable to your patient as the doctor is. So you have to get some level of comfort in talking to the doctor. The doctor is not the end all be all, okay? It don't work like that. It's not a dictatorship. You should have dabbled in passing meds, and you should have some concept of critical thinking. That is it for the first semester, okay? My next video, I want to talk to you guys about the OR. I don't think I actually did that, and I did go into the OR. If not, I have another topic, but I'm pretty sure the OR is the topic of choice. So, thanks for watching. Good night. Love you guys. Take care.